Every 19 minutes in Australia, someone suffers a stroke and cells begin to die immediately. But one WA company is working on a world-first drug which it hopes will significantly reduce brain damage after trauma. Former nurse manager Shane Hopkins didn't expect to become an emergency patient himself in 2012. The 57-year-old needed intensive rehabilitation after suffering a stroke.
One thing that I had to do was, when I finished at Shetland Park, they wheeled me out in a wheelchair, and I said, no. And I stood up and I walked to my mum's car and said, God, thank you.
Now WA researchers, backed by the Perrin Institute and the University of WA, are providing hope in the fight to protect brain cells after a stroke, one of the 5 leading causes of death in Australia. Stroke kills more women than breast cancer and more men than prostate cancer. Lead inventor Professor Bruno Maloney says it's an exciting time.
Yes, it's a real milestone in the field of stroke. We've developed a drug that has the potential to stop brain cells from dying due to the effects of stroke. And I can still remember the first time we looked down the microscope to see the effects of the drug on brain cells. And what we saw was that the cells were completely preserved and viable.
After more than 10 years, Argenica Therapeutics scientists here in Perth are now tantalisingly close to supplying ARG-007 as a world-first drug of its kind. Argenica is one of only a few companies in the world which is undertaking a phase 2 trial in this type of stroke treatment, which has already proved to be safe and tolerable in healthy people.
For the very first time, we are going to test this drug in stroke patients coming into emergency departments across Australia. We're hoping to show that the drug is safe. Secondly, we're going to test whether the drug is actually working to reduce that amount of brain injury in these stroke patients.
The ultimate aim is for ambulance officers or other trained professionals to be able to administer the drug to a stroke patient before transfer to or shortly after arrival at hospital.
Well, the drug blocks a very toxic event that occurs in brain cells after stroke. So after stroke, calcium ions can flood into brain cells and cause damage. So a little bit of calcium inside brain cells is good, but when it floods in and overwhelms a cell, that's very toxic, and it sets off a chain of reactions that cause the cells to die. And our drug blocks that process, and it does it very, very effectively.
1 in 4 people will suffer a stroke, and 1.9 million brain cells are attacked during each minute of that stroke. Only 10% of stroke patients will make an almost complete recovery, and time is crucial for first responders. Stroke can happen at any age. Inadequate blood supply to the brain, such as lodgement of a clot in a blood vessel, results in cell tissue death in the affected area. Increasing numbers of cells begin to die quickly, and this can lead to lasting brain damage, long-term disability, or death. ARG-007 aims to stop the rapid cell death that happens after the initial brain injury, preserving still viable brain tissue. That means more tissue to salvage after the restoration of blood supply to the brain. It's also been shown to help in the elimination of proteins linked to Parkinson's and Alzheimer's diseases. Since his stroke, Shane has completed a degree and is working in a different field. And his mum is really proud.
I just wish that this was available when I had the stroke, because it's a miracle drug which would be fantastic if they had it, because they would not have to go through what I had to go through with the constant therapy and perseverance that I had to do.